When it comes to OCD, there's a couple things that we think about a lot with medication with the SSRIs. So one is dose, which we've talked about needs to be higher, but also length of treatment to see how long before we know if we should move on to a different medication or not. So often we talk about being on it for 8 to 12 weeks. When I talk about that, I try to be really specific because it can't be 8 to 12 weeks at a low dose. It's really got to be 8 to 12 weeks at what we consider to be an adequate dose for OCD. So if I'm using the example of fluoxetine because it's got an FDA indication for kids with OCD. And so if a child is on 20 milligrams for 8 to 12 weeks, that's not going to be very helpful for me to know if it's going to be effective. It's really got to be at a higher dose, probably, at least 40, if not higher, at least 8 to 12 weeks. That's why I also say it's incredibly important if you have ERP in your community that you should be doing that in addition to the medication, because that's potentially 3 months. That's a long time to really wait and see if a medication is going to be helpful. I often have found that if we're not seeing something by, like some kind of improvement by around 8 weeks, then it's unlikely. But studies have shown us even waiting, up to 12 weeks, we can start to see improvement. And then in terms, I get the question all the time of how long a person should be on a medication in total for their OCD. Particularly, you can imagine for young kids, do I have to be on this medication for the rest of my life is a very common question that we get. So we talk about that they need to be on a medication of a year of doing well at a dose. So let's say that they've taken that fluoxetine and they've been doing well. And so I say a year of doing well and then consider when you're going to come off of it. And I try to time it with things that would not be stressful. So maybe during the summer when they're not in school, you just wouldn't want to do it, like in the midst of them maybe having final exams or things like that. And you're going to taper it off slowly. That's the other thing with OCD that we want to be a little bit more cautious about is we want to reduce the dose over a few months, like 2 to 3 months, rather than over a few weeks. And they seem to do better that way.